So thank you everyone for coming today. My name is Britton Slagle. I'm the founder and executive director of KarmaSue. Our mission is to support Coloradan families enduring companion animal cancer through education, counseling, and financial assistance. We'd like to thank you all for attending our first education workshop of 2021. If you are interested in watching any of our previous workshops, please visit our YouTube channel. And if you have any questions or would like to connect with us directly, you can send us an email at admin@karmasue.org. Today, we will have a Q&A section at the end of this workshop. Should you have any questions as we go along, please enter them into the chat box, and our facilitator is happy to answer them as time allows at the end. Today's workshop is titled Meet a Veterinary Oncologist. Our special guest facilitator is Dr. Karen Oberthaler of Treeline Veterinary Cancer Care in Boulder, Colorado. Dr. Oberthaler, I know I'd mess that up, I told you I would, is a board-certified veterinary oncologist and a diplomat of the American College of Internal Medicine and Oncology. I will now hand things over to her to share a little bit more about herself and to begin our informative workshop. Thank you guys for attending today.
Cool, thank you so much. All right, I'm a little new to Zoom presentation, so bear with me while I move these
We're
faces.
here to help.
Okay. Oh, I'm sorry. Oh. All right. Did the slides move for everybody?
Yes.
Okay, perfect. Okay, so what I was planning to talk about during this is pretty general. I just wanted to give some general information about veterinary oncology, what we do. So I figured I'd start by just introducing myself, a little bit about me, and then kind of what a veterinary oncologist is and how we're different than other veterinarians out there. What we do specifically every day, and then a little bit like what to expect when you go to the oncologist. I think that's something that a lot of people aren't familiar with. Certainly from taking phone calls of people asking for appointments, I think that's something that people get really worried about. And then what happens behind the scenes when your animal is at the oncologist. And lastly, I'll just close with what it's like being a veterinary oncologist. It's a fun job. I really do love it. I've done it for years. And so I'll just share some of my thoughts about the job. So a little about me. I live in Colorado now, but I'm pretty much an East Coaster. I was born and raised in Bethesda, Maryland. Both my parents are computer programmers actually, and worked at the National Institutes of Health. So kind of grew up on that campus of National Institutes of Health. And then most of my training was in Philly, actually. I spent probably about 12 years in Philadelphia at University of Pennsylvania for all of it, for my undergrad degree in engineering. And then I went to the veterinary school there, graduated in 2002, which is almost 20 years ago, and then did an oncology residency for 3 years there as well. So kind of left Philadelphia in 2006. And since then, starting in 2006, just a couple years ago, I was in private practice as an oncologist, mostly in New York City. Helped start one of the first Blue Pearl practices actually in 2006, back before it was Blue Pearl, and then a couple years in Miami, and then I moved to Colorado in 2019, so almost 2 years ago. My longtime boyfriend grew up in Boulder, Colorado, and I was ready to leave the city and actually live in a house and have a different kind of lifestyle. So we moved out here a couple years ago, and it's always been my dream to have my own practice. And you know, all of my practice of oncology has been at really large specialty hospital, and I've kind of had an eye to do more of like boutique, kind of smaller practice. So about 1 year ago, I founded my own practice, which is called Treeline Veterinary Cancer Care, and it's based here in Boulder, Colorado. A little bit about me, just in general. I love dogs and cats, especially the geriatric ones. I just love old dogs and cats. And when I'm not at work, I have a pottery studio that I set up in my house. I've been doing that, God, since I was a kid. Love it. And I love to run. And I also have 2 pets. I have a Mastiff who is in the lower corner there. That's Dewey. He's 16 years old now. Health problems are starting to set in, but he's my love. And then we also, like so many other Americans, adopted a puppy this year during the pandemic. He just kind of came into our lives when my nurses found him on the side of the road. So now we have a blue tick coonhound, which is a huge burst of energy in our lives. So I love animals. I tend to be more of like a palliative oncologist, very sensitive to people's concerns about quality of life. I don't think anyone would call me aggressive, although certainly I can't always help guide people that way, but I tend to focus more on the quality of life. And I just want to, before I start, just thank KarmaSue for the opportunity to speak. I honestly didn't know about the organization until one of my own patients was looking for funding, actually. And I have his picture a little bit later on. That client introduced me to KarmaSue, and it's just such a wonderful organization. So when they asked me to speak, I was super excited. So anyway, thrilled to be here, and thanks for having me. So just to start, like, what is an oncologist? So there are veterinary specialties out there. A lot of people just kind of don't know the distinction from general practice and specialty medicine. So to be a veterinarian, and like in human medicine, you can graduate after 4 years of vet school and go out and practice medicine. There's a lot of specialists out there these days. And so most specialists have gone to vet school and then done 1 year after vet school as an internship, where you're already a veterinarian and you're a doctor, but you're doing like a 1 year kind of rotating internship, looking, kind of working under all specialties. And then for oncology, some people go on and do then a 1 year just purely oncology internship, where you're rotating under oncologists just to make sure that you like the specialty. But then after that, you match for a 3-year residency. And those are usually at universities. There's some big private practices have them too, where you spend 3 years kind of being mentored and learning what it is to be an oncologist. And after that, there's a board certification process where you take first a qualifying exam, which is just kind of general medicine, because we're in the same colleges as like neurologists and internal medicine specialists. And so there's a big volume of specialty medicine we need to know. And once you pass that, then there's a certifying exam where they kind of test you on all the literature that's out there. You have to kind of know all the journal articles and how, just everything that's current about cases in oncology. And then after that, or kind of concurrently, also have published a peer-reviewed paper. And so once you get through all of that, you're certified by the American College of Veterinary Internal Medicine, and oncology is kind of a subspecialty under that. And so any oncologist out there is going to have the designation DACVIM, and that's Diplomat of the American College of Veterinary Internal Medicine Oncology. And I know that sounds really wordy, but it is really useful. Like if you're looking for an oncologist, you'll see a lot of different people that practice only cancer, but as far as oncologists, they have to have that kind of designation. And when I finished, I believe there was like 100 oncologists out in the United States, and now I'm going to guess 500. I don't know. There's a lot more. But it's rather small specialty. You'll also see people out there that have the designation practice limited to oncology, because all this used to confuse me too. That means they've basically gone through all the residency and are kind of in their board certification process, or maybe trying to pass the test or write the journal article or something like that. But that doesn't mean they're not boarded yet. So practice limited to is a very specific phrase that means trained but not boarded yet. So what do? Oncologists, we we work to detect cancer. We can screen animals for cancer. We can kind of work them up and diagnose them. I didn't highlight those words because like certainly I do see patients like that, but for the most part, when an animal comes into the oncologist, they already have cancer. So the bulk of what I do is staging, which is kind of screening to see like how extensive the cancer is, and then treatment. And I'm a medical oncologist, so I do mostly medications, but certainly guide people to some of the other specialties. And then post-cancer treatment, long-term kind of follow-up. Because a lot of these animals are in treatment for a little while, then they finish off, and then sometimes we'll see them like every 3 months or so and do screening, or if something comes up, then we can address it. So for cancer detection, Dr. Braddock was speaking. I don't even know the time. I was at like a month ago. I think she did a presentation kind of talking about cancer detection, and the general family veterinarian is somebody who does that a whole lot more than me. Someone, a family recognizes that their animal, their dog or their cat has lumps or swelling or is drinking differently, drinking more is usually something to worry about, or losing weight, despite the fact that they're not dieting. Sometimes like bleeding, like nosebleeds, or bleeding from the hind end, bleeding from the mouth. Those are things we worry about with cancer. Any change in breathing pattern, or sometimes you can smell it before you see it, all of a sudden a change in breath. Or limping is something that we'll also detect. I mean, there's so many signs. Having seizures late in life is something we worry about, but usually I don't see a patient at this point. This is when they're going to their family veterinarian, kind of working someone up. So we work closely with family veterinarians. So I'm always a huge advocate of kind of regular screening and geriatric screening. And so, once a year physical exams with your vet. And once an animal starts getting a little bit older, going in every 6 months, getting physical exams, getting weighed, having routine blood work done every 6 months. I know it sounds to people like it's overkill, but it's so helpful because you really do pick up on things early. Doing dental prophylaxis is so important. Dental tumors are one of those things, like if you find them early, the prognosis is so much better. A lot of those can be cured if you find them early. And then doing chest x-rays in older animals. I know sometimes that's optional, but if they're going in for a dental procedure, doing chest x-rays and just making sure that there's nothing concerning there. And that's all stuff that the general vet does. And just to take a step back, like what cancer is, before I kind of delve into like what we do with it. If you think back to the cell, like every cancer comes from a cell, and it comes from a normal cell. And so normal cells all over the body, your whole body is made of cells. And so cells mutate, and they mutate in us, they mutate in our pets. And usually like a cell mutates and our immune system like recognizes it as a cell gone bad and kills it, and nothing ever comes of it. And we don't even know that it's happened. But with cancer, you get a cell, it mutates, becomes abnormal, and then the body doesn't recognize, the immune system doesn't recognize that it's a bad cell. And so then all of a sudden it starts dividing. And it can kind of divide out of control, and that you get this like clonal population of a very abnormal cell. And that's what makes a cancer. And so any cancer is really coming from a normal structure. And there's like 3 main types of cancer that we see in animals. And those are like cancers of glands. So anything in the body that like makes something, like a salivary gland, a mammary gland, they all make things. And so any cancer of a gland is a carcinoma. So salivary carcinoma, mammary carcinoma, prostate carcinoma, stomach, like gastric carcinoma, pancreatic carcinoma. So gland tumors are carcinomas. And then you have like the architecture of a body, the connective tissue, the support of the body, the structures that hold a body together. So bones, tendons, ligaments, muscles, like all of those cells are very similar. And so if any of those cells mutate and form a cancer, those are called sarcomas. And they just behave very differently, like carcinomas, sarcomas. And then The third category is like the fluid tumors, like blood tumors. So tumors of cells, tumors of blood cells, like white cells. Lymphoma is a huge one. Like that is a circulating blood tumor, leukemias, those kinds of things. And so they tend to be in like 3 classifications. And so, when people come to me and their animal has cancer, I kind of go through like, well, where did this come from, and how's it going to behave? And so those are really kind of general things, but that's how it kind of breaks down in the body. And an oncologist, our main job is to help people kind of through the options of treating that cancer. And there's 3 main ways you can treat cancer in animals. The first 2 are really kind of local therapy. Like say you have a tumor, you really want to focus, like, can you get it out? If you can't get it out with surgery, can you radiate it? Which is like you direct a beam, and I'll talk a little bit more about this later, onto the tumor and see if you can treat it that way. Chemotherapy is more medications, and those are systemic medications that you can give to kind of control for cancer that might have spread through an animal, or systemic, or we worry it's about going to be systemic. And so for the most part, a lot of what I do is some of this medical management and chemotherapy and more systemic things, but also like oncologists are like the kind of the not the gatekeeper, but we kind of like shepherd people through the other modalities. Like people, you wouldn't know like, oh, do I need to see a surgeon or radiation oncologist and medical oncologist? No, you see the oncologist. And then we kind of try and get people to the right place. And then when they're done with whatever they're doing with the surgeon, then they come back to us. And we tend to be the ones who kind of like help organize your pet's care. So I just alluded to this. There's actually 3 types of oncologists. And when we talk about like most oncologists out there, they're medical oncologists, and that's what I am. And so there are surgical oncologists, and those are surgeons that have kind of gone through their specialty, and then they've done a 1-year fellowship in just cutting cancer cases. There's not a lot out there in the United States. When I was practicing on the East Coast, there was just like 1 in the region. They're really rare. They're amazing surgeons, and they're really sensitive to the kind of principles that you need to do surgery on cancer cases. Not only like the surgical principles you need to operate on cancer, but also the kind of conversations you need to have with families that their pets have cancer. Like it's a different type of approach, and it's a different type of veterinarian. So surgical oncologists, they're amazing. There's just not a lot of them. There's actually more per capita in Colorado, because Colorado, CSU is one of the training centers. So I think people come out here and they love it and they don't leave. So there are surgical oncologists to be found in Colorado. And then radiation oncologists are, there's a little bit more of those than surgical oncologists, but they all work with radiation machines, which are huge. I have photos of them coming up, but they're a large linear accelerator, kind of human type radiation equipment, and they deliver beams of radiation that damage cancer cells. And radiation oncology has been this kind of growing field over the last couple decades. And so they're hard to find because they need a machine to operate, and the machines can take millions of dollars to install. But they are technically oncologists too, and they're great to work with. And then there's medical oncologists, and that's what I am. This is what people are usually talking about. These are the people that are certified through the College of Veterinary Internal Medicine, and so we give therapy, we navigate families through all the different types of care. When we talk about treating cancer in pets, I think there's a huge obstacle, a huge barrier to kind of get through with most people, and it's probably not people that are watching this presentation, but maybe in the general public, like people are very scared to do anything to treat their pet's cancer because of the experience that they've had on the human side. And so something that I wanted to express in this presentation is not the same as human cancer treatment. Like, it's so different what we're doing. Like, we are doing palliative care. We are trying to make animals live comfortably, with dignity, with pain-free. And a lot of people, when I talk to people, they say, well, I saw what my family member, my friend went through, grandparent, like I would never want to put my my dog through that. Or they think right away, like, using cancer therapy for pets is a way to make them suffer, and it's selfish, and it's doing something for me, and we're just trying to extend their lifespan. And that's not at all what veterinary cancer treatment is like. Like, it's a completely different philosophy. And so I've kind of heard it all from families. They're just really nervous that they're going to come and see an oncologist and kind of get railroaded into this like aggressive therapy where maybe a dog will live longer but not be happy. And so just something that we end up talking a lot to people about. It's just like, it's a different way of treating animals. They don't know their quantity of days. Like, they live in the here and now. They know their quality of life. And so that is so important in veterinary oncology, like that they have really good days. And if they happen to have more of them, that's amazing. That's for us. But each day should be good for them. And so that's kind of what we do in veterinary cancer. So it's palliative. I put this picture here because this is a really common cancer treatment, is amputation on usually dogs, but cats as well. And depending on why we're doing an amputation, like, it can be curative. And even if it's not, like, taking off a limb can be palliative because it reduces the amount of pain that animals are feeling if there's like a bone tumor, for instance. And so we just want animals to be comfortable. I mean, this golden looks super happy and comfortable. And another thing with animals that is so different from people is the way animals are perceived by other animals. Like, they don't care. They don't care if they're like in a wheelchair. They aren't treated any differently by other animals. There's no judgment if they're, they look ugly that day or gain weight, lose weight. Like, if they're comfortable, then that's what matters. We talk about this cone of shame thing. Dogs don't care. Like, this is all on us. Like, they don't get embarrassed. They just like live in the here and now with comfort. Yeah, they might not like the e-collar, but they don't have that kind of sense of shame or self-consciousness, I think, that people have. This is another one. This is one of my patients, little Dobby, and he had cancer, and his mom, super cool. She made him this hoodie. He always sported the hoodie, and it is a little censored by the hood, but it does say F cancer. And the thing is, like, he didn't care he had cancer. He just cared that he was comfortable. So sometimes the burden is really on us. Our patients are comfortable. And this is another thing, like this, dogs don't care. They don't care if, they don't have hair, they're missing an eye, they're missing a limb. They just want to be comfortable. And again, that's why I do what I do. Like, I just want to see the dogs happy, and a lot of times, and the cats, and they truly are. So I'm just going to go through some of the modalities we have to treat cancer, and a little bit what I do on a day-to-day basis. So the first arm, so I'll talk about surgery, radiation, and some of the medical management. Cancer surgery, it truly is like one of the times that we can cure cancer. When we're talking about medical management, we don't often cure cancer. Surgery actually can. So when you find things small, there's a saying out there, a chance to cut is a chance to cure. So always something to keep in mind. And I think one of the things that I do as an oncologist, even though I'm not doing surgery, this is a picture of one of my friends. She's a surgical oncologist, but one of the things I do is kind of, if they'll come to see me and they're super scared of surgery, I'll talk to them about it and kind of what to expect. And, you know, what I hear a lot when people come in is like, oh my God, that's like, that surgery is so extreme. It's so deforming. I would never do it. And like, this is one example all the time that is actually can be life-saving, and is one that I don't want to say we talk people into, but we educate people. It's not that bad, and it can cure your dog. And so dogs that get oral tumors, you actually have to sometimes take off part of the jaw, but then they can be cured. And depending on the tumor, obviously. And right away, people get very scared of a surgery like that. But I put this picture of this beautiful dog here because like you almost don't even notice the tongue, like his like tongue is sticking out, because what holds the tongue in the mandible sometimes are the lower canines. And so if you've removed a canine, then I mean, you see this in Chihuahuas and Yorkies all the time, like the tongue just like slips out. But what sounds like really crazy, maybe when you first think of it, if your dog has a little tumor down here, it might cure them, and it's something to consider. And so I'll talk to people about that. You know, this is another picture of the golden with the tongue hanging out. And you know, if you think about it, so here's the canine skull. I don't think I probably do have a pointer here, but I don't know how to use it. I don't know if you can see this, but so say if you have a tumor down here, even gum tumors, like they go into the bone. And so usually to remove them, you have to kind of take off a little piece of the bone. And so that's called like, that can be like we call this like a rostral mandibulectomy. And just kind of removing this piece. If anyone is watching is kind of grossed out by like a surgery picture, just turn away for the next slide. But this is like a section of bone that's removed from a dog's jaw. It has some of the incisors here, and then the canine, and then that can be curative for a dog. And so certainly like this little dog, missing a little piece of his jaw, but like then they're otherwise happy. And so certainly it's a nice treatment for canine, you know, oral tumors, and something to consider. It's not for everybody, but I certainly do talk to people about that. Another tumor that's surgical and is cats that so if you think about the nose in any dog or cat, the nose goes from like the middle of the eyes down, and we usually think of the little fleshy part on the tip of the nose as being the nose. That's the nasal planum, but actually the whole kind of muzzle or snout is their nasal cavity. But so cats can get nasal planum tumors from sometimes spontaneous, sometimes from the sun. And this is a little kitty that has a squamous cell carcinoma from the sun on the tip of the nose. And so the surgery to treat this, to keep it from kind of eroding back, is, I mean, when you say it, it sounds horrible. It's a nosectomy, you remove the nose. But in reality, what you envision might not be so bad. And I have a picture on the next slide of a cat that's had a nosectomy. And like, honestly, like for something that could take something from completely life-threatening to curative, and the cat is really comfortable, and they can still smell. It just has like a blowhole. Another one is cats with ear tip oral squamous cell carcinomas. This is another solar-induced tumor. And so this picture on the left is actually, I mean, that's the cancer. So the tumor is actually on the ear tips, and it's causing bleeding, which is what those crusts are. It's really like eroding the skin and then the underlying cartilage of the ears. And what happens with these things is they just progress and progress. And then they can also invade lower, they can spread to lymph nodes. And so the surgery is curative. And so initially people might be kind of put off by that, but if it can be curative, it's just something to consider. In this case, like we, took the ears off, did a penectomy, and post-op it looks kind of, it looks different, but then like a couple, weeks to months later, the hair grows in, and then and if it cures your cat, they're totally comfortable. So just something to think about. Surgery it can sound extreme doing surgeries with surgical oncologists, but really they have the best cure rate out there of all oncologists, and something to consider. The other thing is like a second modality of cancer treatment is radiation therapy. And radiation therapy has changed so much in the last decade and continues to improve. There's phenomenal things you can do with radiation therapy. Radiation therapy is, it's a very localized treatment. There's nothing systemic about it. So you can only treat kind of like a solid area or a scar or something really focal. And I'm not a radiation oncologist, obviously, and I don't do radiation therapy, but a lot of my consults involve talking about it because there's so many different cancers where you have to kind of pull in a radiation therapist if people want to kind of approach a tumor a different way. And so a lot of the options we have for treating cancer involve radiation therapy. And so essentially radiation is a very local treatment. Really common tumors that we treat in animals are tumors of the brain, because those are really hard to get drugs to control. Surgery is really hard in that area. And radiation, you might even hear it called radiosurgery. This is really high dose kind of conformal beam that can get into the tumor in the brain and kind of almost like melt it out. It almost like sculpts right around the tumor. So brain tumors are really common tumors treated with radiation therapy. It's almost like standard of care right now. Bone tumors, there's great options for radiation therapy. Radiation's great at you can put it right on the tumor of the bone and it can dull the pain fibers. So it's a wonderful palliative option. And radiation certainly doesn't hurt when it's given. It's like an x-ray, and then nasal tumors, not the nose tip, but like back in the nasal cavities, those, back in the day, try and do surgery to remove them, you just can't. They're so invasive, and now they're treated with radiation therapy, and the success rate, I mean, some of them are cured, some of them are gone for a year or two or more. Dogs do, and cats especially, do really well with radiation therapy to the nose. So another thing, if like a tumor has been removed, and say it's a really invasive tumor and it's maybe on the leg where you don't have a lot of room, and then there's cells that remain down the scar, and you're still trying to keep it from growing back, you can do radiation therapy on a scar. And what it does is it'll damage those cells so that when they want to grow a new tumor, they can't divide and replicate, and so it can kind of clean up a scar. So that's a really common way it's used. Another way you can use radiation therapy is say you have kind of your dog or cat has this really big nasty tumor maybe on the outside of the body, and you're thinking about putting your animal to sleep just because it's untenable and you can't really, it's bothering them, or maybe it's oozing. You can use radiation therapy on a big kind of weeping mass, and it can dry it up. It can just provide comfort. You can use it for pure palliation. That's not gonna extend an animal's lifetime, but it's gonna make them way more comfortable, so that maybe they're not chewing at it or something. So it depends. It can be used so many different ways, from really intricate radiosurgery for brain tumors to just a point and shoot. Can you just provide some comfort so that we can have a few more months with your loved animal. Something else that's really cool about radiation therapy is, even though it's like a beam that comes down, there's so many ways to direct it so that, say you want to hit something under the surface, not on the skin, but maybe right under the surface, you can change the way it is directed so that the the main dose hits at different levels. Like there's a lot to radiation therapy, which is why it's a whole specialty. But you can do so much with it. Like I said before, it's painless. It's, it's like an X-ray, does not hurt. Unfortunately, we need to use general anesthesia or really heavy sedation. Sometimes people call it like twilight sedation, because you just can't have an animal move. Like they need to be set up perfectly positioned, and then all the staff needs to leave the room so that they don't get any radiation dose. And then the machine is on for however long it's on, whether it's like, a few seconds, few minutes, or longer than that. With the staff outside the room, you just need your pet to be still, and that's why we use anesthesia. But there's no pain meds involved in that, so there's no real grogginess associated with the anesthesia, like when they wake up, and that's why people call it like twilight, like they kind of just wake right up, have their lunch, go home after the treatment. Most dogs and cats, when they're getting radiation therapy, it's usually like a process. Like it can last for about 3.5 to 4 weeks. Sometimes there's different courses out there. Obviously, some are like once a week for 4 weeks. Sometimes it's like 5 days a week for about 3.5 weeks. Like it completely depends. The way it works is the same way, like say sunlight damages, like it can damage DNA of the cells. Radiation, it's like ionizing radiation in the beam. It's going to damage the DNA of the cells that it hits. And what happens if you give enough dose, then eventually that cell is going to be fatally damaged and can't replicate. And so just briefly, the way it's used is you give these kind of like little daily doses, and what happens is you're damaging the cells, all the cells in its path every day. But like normal cells can repair themselves, and they can they've got good repair mechanisms, and they can like put themselves back to health. And the cancer cells like abnormal, and like it can't quite repair the DNA damage. And then, so it's almost repaired back to normal, and then you hit them again with the same dose of radiation the next day. And again, normal cells can repair themselves. Cancer cells, again, are like sluggish. And so if you do that, 20 times, you're basically going to eventually fatally damage the cancer cells, but the normal cells have robust repair mechanisms and are going to be fine. So, it's a great mechanism. This is a machine, a radiation machine, and they're same as, most of them are human machines, but there's a stretcher there that the patient lies on, and then the beam kind of comes out of this big, comes out of the top area here. And then this whole thing can rotate, so you can have a patient on this stretcher and have the beam kind of come from either side. So I know most people have not seen this, and this whole room is like shielded so that when the staff leaves, nobody gets any sort of radiation. Here are, this is at the last practice that I was working at. This is a patient getting radiation, and you can see there's anesthesia and lots of monitoring equipment. We had a radiation therapist who actually came from the human side of things, because it's all the same, technology. And here, this is a dog who's getting radiation, and actually the beam is coming, it's kind of got rotated on the side, and like you can't really see it behind the technician who's doing anesthesia, but it'll be radiating the back end here. And so all of this gets set up, and then everyone leaves the room, and there's a whole monitoring channel. And you can kind of see here, there's a camera into the room. They're monitoring anesthesia. They're making sure it's going in the right area. Here's more cameras. So it's a really sophisticated treatment modality, and all radiation places are pretty similar. This is all kind of going on there. And so as a medical oncologist, I work really closely with radiation oncologists, because there's a lot of times where you need something like radiated, maybe a scar kind of dried up, and then they'll come back for like further medical care. This is what I was mentioning before, like if you need it to like shrink a mass, like this mast cell tumor on this boxer's foot, really bothersome at that large side. And then once you get a couple doses of radiation, and they can really shrink down and provide a lot of comfort. This is this kitty, this little Siamese kitty had a nasal tumor, and you can see, so this, rather than this being the nose, the whole kind of top of the snout is the nose, the whole muzzle here. And this cat actually showed some like white coat changes because it will kind of blanch the hair. And I actually have a couple pictures in here, just more like gee whiz, to kind of show people some of the effects that radiation can do. This sheepdog actually had a nasal carcinoma, and we did radiation therapy. And what happened is, I mean, he was cured of his tumor like six years out. He was still doing well, but did lose all the hair up here, and then actually had to. He liked to swim in the family swimming pool, and so they were always putting like sunscreen on him. But yeah, so that's something to remember. Sometimes they can lose their hair a little bit, or sometimes the hair can go white. Obviously, in this, I think this is Skipperkey, but like his hair went white. This little kitty had nasal radiation, so you can kind of see sometimes there's like late effects, but it actually worked really well getting up into the nose. Chemotherapy is the bulk of what I do as far as treatments, and most oncologists, they have a lot of patients getting chemotherapy. And chemotherapy is systemic medications. It's really rare that we would ever put like chemo in a tumor, although you can, or put chemo in like a cavity, like in the chest. But for the most part, it's all intravenous drugs or oral drugs. There's a lot of oral chemotherapies out there that we use in animals. And the point of chemo is it can kill rapidly dividing cells. And so like chemo doesn't know like a normal cell from a cancer cell. It just looks for cells that are in like different phases of division. And so it attacks, like if you think back to Bio 101, like cells that are in phases of mitosis, for instance, or if they're having DNA synthesis in their cellular activity, if you give chemo, it can disrupt that. So in like a normal like adult dog or cat who's not healing from a wound, healing from surgery, is not pregnant, there's not a lot of cells that kind of turn over that much other than cancer cells. So those are the cancer cells are the ones that are actively dividing. And so if you give chemo, that's going to kind of affect those cells in the cancer. That's why you can, and we worry about side effects because you don't want to affect other cells in the body that kind of have a high division rate. But for the most part, it's the cancer cells. So like the doses that we use in veterinary medicine, even though most of the drugs that we're using are human meds, they're really well tolerated because we're using really small doses. And so dogs and cats, they rarely have side effects. They rarely lose their hair. People, like a hair follicle is always growing. And so if you give chemo, it's going to affect the hair follicle and you can kind of lose hair. If you think about like a dog or cat, for the most part, their hair is static, like it's in the stable phase of growth. Like you don't need to bring your Labrador retriever in for haircuts all the time because their hair grows to a certain length and then it's stable. And so that's why we don't really see coat changes in animals with chemo. Although you can see like they might lose their whiskers or their little like eyebrow tufts, but it's super rare. And one thing we always give with chemo is it's given with love. So I have like a variety of pictures in here. Some of them are pre-pandemic. So this is obviously pre-pandemic. We cannot kiss our patients anymore. But so this beagle, you can see the chemo setup. It's about to give doxorubicin. It's like under the table here. She's just waiting for chemo. But we do love our patients. So chemotherapy being the bulk of what I do, there's a lot of uses for it. The most common ones are animals that have lymphoma, a lot of like really aggressive mast cell tumors. It can benefit. Bladder cancers are really sensitive to chemotherapy. Bone tumors, Chemo doesn't do anything for the physical tumor of the bone. Like that needs to be taken care of with something for pain, whether that's surgery, radiation, drugs. But then chemo can really has kind of remarkable effects on trying to keep the spread of the tumor or the metastasis at bay. And so, probably lymphoma is one of the most common cancer I treat. And this picture is a dog, and they're kind of showing how big the lymph node or the gland is. And so you can, a lot of dogs will go into remission on chemo within a couple weeks of treating it, where all that just goes right back to normal. So it's really common to use it in lymphoma. This is another, maybe I should have had a graphic warning on this. I'm sorry if anyone finds it disturbing. This is it's a rare form of lymphoma. It's called cutaneous lymphoma, or mucosis fungoides is a human term that's often used, but it's lymphoma that goes right to the skin. So it's a white blood cell tumor, but it can make the skin slough. It can do weird things to the skin. And so often it's not diagnosed until it's pretty advanced, because it can look like pyoderma or just like regular dermatitis stuff. But with lymphoma of the skin, with cutaneous lymphoma, like they respond so well to chemotherapy, and dogs do so well with the treatment. So this is one I just have some examples of like how well this dog responded. The chemo that we give, the best chemo for this is an oral chemo. It's given every 3 weeks, and it's really well tolerated in dogs. It is called lomustine or CCNU. So this is how this poor thing looked when it presented to me. And then the time of the second dose, just 3 weeks later, it's already cleared up so much. The dog is so much more comfortable. And then by the time it was back for its third dose, so just after 2 doses of this oral chemo, it's already like almost in a complete remission, and so much more comfortable. So chemo can do some remarkable things with dogs and cats with lymphoma. It can also, it's rare, but it can be used to treat solid tumors. This one, 1 dose of chemo in a specific type of transmissible tumor of the mouth can make them shrink up. And so that's why it's so important to kind of get like a biopsy before going to surgery, because this particular dog, yeah, you can treat it with chemo, whereas other dogs would have to go to surgery. I mentioned this before, but with osteosarcoma, which is a bone tumor, osteosarcoma is so highly metastatic, meaning like it can spread in so many of dogs by the time you even find it. But with a short course of chemo, anywhere from 4 to 6 doses of one drug, it has changed like the survival rates to like anywhere from like 1 year after the amputation to like 25% of dogs are still cancer free at like 2 years. So it can do remarkable things, and they feel good when they're going through it. I won't spend too much time on this. I only have like a couple technical slides, but this I just wanted to illustrate kind of like why our patients don't tend to get adverse effects and from chemotherapy. And so on the axis going up, that's the amount of patients having the effect, whether we're talking about a therapeutic effect from the drug or an adverse effect from the drug, depending on the dose that you're giving. And you'll see as you go up in the dose of the drug, like almost all the patients are going to have like an adverse event. But if you're on the low side, you're going to start seeing animals that have like a therapeutic effect from the drug, but no adverse effects. And so what we've done in veterinary medicine is like we, in general, start all of our patients at a dose where like 85% of dogs and cats aren't going to have any side effects at all. And probably 15% will have something from chemo, and hopefully it's mild and self-limiting and we can address it the next time around. But what that gives us is most patients are going to have a therapeutic effect at that level. If I ever had someone say to me, like, I'm so nervous about any side effect, like, you can take the dose down just a smudge and kind of cut off the tip of that curve down there where you're not going to see adverse effect. You might sacrifice a little bit on the efficacy, but that's kind of like the window where we're working, where like most animals can get good effect from the drug without having like an adverse effect. I think the trade-off is we're not curing them. We're not willing to kind of put them through any sort of like payoff, now for later kind of thing like you would in a person, because they just have no concept of how long they're going to live. And like I said before, usually patients don't lose their fur. Dogs that need grooming, like Maltese, this is why I put it up there, they can. Sheepdogs, poodles, like dogs with like hair. But nothing a sweater won't fix. And then it comes back right when you stop. Like they get their coat back within weeks. One thing I did want to mention is like why is chemo so expensive? There are some chemotherapy visits that are pretty pricey, and I know something that's something KarmaSue is very sensitive to. Like some of these therapies that we're doing, they're expensive, and the reason for that it's kind of twofold. One is some of the drugs are expensive, and it's also not just the drugs, but it's the monitoring. Every chemotherapy appointment, like we'll do blood work and monitoring. We're also like, we had PPE before it was cool. So we had we wore N95s. We've been wearing them for decades with chemotherapy, because ultimately those drugs are mutagens, and so we want to protect our staff when we handle them, and so we don't want any kind of vapor getting into the air, inhaling it. So we're really we wear a lot of PPE. We go through a lot of PPE with the gloves and the gowns and the masks. And then over here on the left, I have a picture of like a chemo setup. There's one that, like, you can see the caps on the syringes. Those are closed system transfer devices. Like I use the face seal system, where when you're putting a syringe in a bottle, there's absolutely no air that's exposed, or no drug exposed to air. Like it's so safe for the staff. We use, I don't have a picture of it here, but we have a chemical hood, like a big hood where you're working under, where there's kind of glass in front of you, where it's going to suck the fumes out. And so these drugs are handled with a lot of care, and they're hard to handle and manage and handle safely, and we want to protect our staff. So there's some of that is it worked into the cost. So some of the visits, like, they can be a little expensive to kind of account for all of that. Just a couple more pictures of some of my patients getting chemo. You can kind of see the setup here with my nurses wearing PPE. There's chemo in that syringe that's blue over on the right, going into a catheter. Another thing that an oncologist will do is use something called targeted therapies. And those aren't really chemo drugs. Palladia is a big one if you've heard of Palladia. That was the first FDA-approved cancer drug for dogs. But Palladia is something that will bind to the outside receptor on a cell. And so this picture of a cell showing molecules that will bind to receptors. And usually what happens is the molecule binds, triggers something in the cell, which ultimately can kind of trigger it to divide and replicate and grow. And so Palladia can kind of block that receptor in cancer cells and kind of keep them from growing. Doesn't necessarily kill them right away, but it will hopefully stabilize it, or just kind of keep the cell from dividing until it dies on its own. And so they're called targeted therapies, meaning they only kind of bind to certain receptors. And so if we know that a cancer has receptors on its cellular surface, we can use this drug. It's an oral drug. You take it home, and then it's distributed through the body and kind of binds to the cell. And really, it's not quite as elegant as like a lock and key effect, but it can really it can really reduce kind of any toxicity, really tolerated well, and it has a very specific effect on cancer cells because they're the ones with the receptors. Another thing oncologists do are immunotherapy, so cancer vaccines, and the melanoma vaccine is a huge one of these. It's not a preventative vaccine. It is a treatment vaccine, meaning you can give a piece of DNA, like foreign DNA, it's labeled for use in dogs, but we can use it in cats as well. And for melanoma, it's the tyrosinase gene, which is like the pigment producing gene of a melanocyte, a pigment producing cell. And so if you give a little piece of DNA of the pigment producing gene that's not of a dog or cat, then the dog or cat's immune system starts making a response to this piece of DNA, and it's similar enough to their own tyrosinase that eventually their immune system is going to start attacking their own tyrosinase, which is this pigment producing gene in melanoma cells. And so you can get this, like, you can train an animal's immune system to start attacking the cancer. It's a phenomenal kind of new branch of, it's not that new, but branch of cancer care. And so that's something that oncologists do as well as the melanoma vaccine. It's a needleless injector. And so the picture on the left shows it kind of going into a thigh muscle, and then it kind of goes in, the DNA has an immune response, and down the line will prevent recurrence of the melanoma. It's really an interesting mechanism. So what can you do if your pet was diagnosed with cancer? Like, one thing I tell people is, like, don't panic. A lot of times there's a lot we can do. And research, there's good books, there's great websites. One of the things I love about KarmaSue is it's got a whole education platform. I know this is part of it, but there's going to be good information out there. The main oncologist organization is the Veterinary Cancer Society, and there's more and more information for pet owners on there about tumors. Morris Animal Foundation does a great job too. I don't even need to say this. Use common sense around Facebook, other social media. Such a mixed bag. There's such great stuff out there. There's such bad stuff out there, and so obviously, I mean, it's a mixed bag. Talk to other people. Talk to your vet. They're such a great resource. And then if you need an oncologist, look for one that has the ACVAM, board certification. And the last thing to do is, like, don't feel bad if you can't afford what's being presented as standard of care. Like, there's so many options, there's so many treatment options, there's so much we can do, and so many people can't, like, go to surgery, then radiation, then chemo, like, and maybe that's not even appropriate. But don't let guilt ever kind of cloud your mind, because, like, animals, they just want to be comfortable. Like, they don't care how long they live, so just, like, enjoy them. They don't have the burden of knowing what they're dealing with. So what to expect? We know it's stressful going to an oncologist, and I know that one of the most important parts, which is the visit in the room with the oncologist, is we don't have it anymore because of curbside and COVID. And so that's really hard, I think, for people going to see an oncologist, to have it all kind of curbside. Eventually that's going to be back to normal, but we totally get it. Like, we know that it's stressful. Like, it can't be fun to, like, sit in your car and have your animal kind of taken away. I can't wait till COVID is over. Like, we do the best we can, but it's one of those things. And usually what happens is, like, when you make your appointment, we will get all of your veterinarian's information. We'll get any kind of specialty hospitals you've been to, emergency hospitals. And then when you arrive at the oncologist, we'll usually, you call us, we'll greet you at the car. Usually one of my nurses will go out and bring your pet inside. Just so much safer to do an exam inside rather than, like, in the parking lot. I know people have asked me, I'm so scared that, like, animals are going to run off. And I should do it. Shout out. This is Bubba getting love from Jordan, one of my nurses. Bubba was, he's my recent KarmaSue patient. Like KarmaSue really helped him with his therapy. And then, so once they come inside, I do a physical exam, kind of go through everything. And then we have the chat. We talk about the cancer. Some people want to kind of start at the beginning, go through everything. Sometimes people have already done their research, sometimes in the second opinion. So it's all kind of what you want, and kind of just like, I'll ask people in the beginning, like, do you want to kind of start at the beginning and like, or do you go through like what this cancer is and how it progresses, or do you like already have specific questions? And usually people will tell me like what they want, and we'll talk about the cancer, the progression, the prognosis, how to tell if it's spread, how to treat, different ways, what to expect, if we do treatment, if we don't do treatment. And we can either kind of stop there. It's a lot of information, or sometimes people come in and like, okay, I want to screen. I want to know how far it is. I want to know like what, treatments are available based on that screening test. Or sometimes if it's like chemo, we can do the treatment that day, but there's also like no pressure to do those things. Like I'd say most of the consult, maybe 50-50, are like just information versus like information and doing something. And I know like at that point, I know it's a blur for people. Like most people go home and kind of like, what do we talk about? And then they'll get in touch with me again and be like, I'm sorry, can you like tell me again? And that's really common, and I get it. And I think some of that is like it's worse in like the car with COVID, and not kind of being in a room where we can go through things. And I try and do most of these talks outside, but it's hard when the weather's bad. Sometimes we're on the phone, but because I know like the personal connection is so important, especially with cancer. But we do the best we can. And we get it. It's hard. It's hard to be away from your pet. And we're also trying to kind of take care of our staff and be really clean. And we just want people to know, and I hope it's obvious, that everyone working in the animal industry is like an animal lover. And so when we take your dog or cat away, they are getting so much love in the back. I just put some pictures in here just to kind of reassure people, like they get treats. Like I know people are like, oh, I don't want my dog in a cage. Like a lot of times I don't use the cage because like I'm sitting in an exam room, because the exam rooms aren't used anymore and so I'll have an animal at my feet. But like sometimes they're in the cage and the cage door is open because they just chilling out. That's one of my favorites right there in the middle. Boss is just hanging in the cage. He didn't need the door closed. And we also give a ton of snuggles. Like we just, we love the animals that you love. Like they're wonderful. This is one of my most recent patients. He's super nervous at the vet. And so of course his family's super nervous, and he came in for his first chemotherapy. This was actually last week. And so when he was with us, when he finally got in, and he was relaxed. And so we took some pictures to show to his family, like he's actually okay. This was right before the chemo on the left with Jordan, one of my nurses, and this is during the chemo on the right. He actually passed out. And this is another little dog who, again, is nervous, didn't want to go in a cage. So he got put in a lap. And so Jordan is writing up some medical orders, and Rudy's on her lap. And then of course, when he got his treatment, he also fell asleep. And just, I know I'm running late on time. So lastly, I just wanted to say, like, I absolutely love being a veterinary oncologist. It's an amazing job. I love seeing your pets. It's such a privilege for me to be trusted with their care. I know that animals do so much better with cancer care than people do. We rarely keep them in the hospital. Our patients are not worried about what they're going through. I know that we are, but they tend to be happy. And one of the main reasons I like it also is it's like one of the few specialties that you can have where families come back. And you get to know people and you have relationships. Like I'm not a surgeon or an emergency doctor that like fixes something and never sees them again. Like usually if you're coming in and then you need to come in a lot, like we get to know you. We definitely get to know your pet and their quirks and what they like for snacks and how they cross their legs, but we develop relationships and it's really rewarding. And so these guys, it just doesn't get any better than working with them. And like, I think there's a certain dignity that comes with age, and like you just want to preserve that and you just want them to be happy in their golden years, the sunsets of their life, and make sure that it's handled well. And that's whether you do cancer treatment or not. Like you just want them to like live in the present, be happy. I know time spent with them, it's a gift for me. It's so special. Like every day is a gift. And their affection is so extraordinary. This is my own pup. He's 16. And this is one of my patients that, she lived with her lymphoma over 2 years, and she would go outside in the snow in New York City, which is a huge risk, but she was great. So anyway, sorry I ran a little over, but I wanted to open it up. Well, I guess first I wanted to thank KarmaSue again. Like it's really a privilege that I am able to kind of talk to people. I'm really like excited to work with the organization. I think it's such a good organization. So thank you for having me here.